Hello, Dr. Zacharia. How are you today?
Very well, thanks, Mara.
Great. I've just actually come in because I just want to ask you a few questions that could help patients understand a little bit more about the Promoitalia threads. And they're a very well established and quick and easy procedure. Could you explain to us a little bit about the Promoitalia threads, because I know you've used them quite a bit in your patients?
I've been using threads since probably 2001, 2002, and one of the problems has been with the threads that in some patients they don't like the idea of them being a permanent sort of treatment or permanent thread. And so one of the advantages that I've seen with the Promoitalia threads is that they come in a combination of permanent and or the dissolving, absorbing threads. So that's one of the benefits that I've seen. The threads, of course, have tiny little barbs on them, and so the whole procedure involves placing the threads in certain positions and holding the tissue into the new position. And the threads do this by a combination of initially creating an actual pull on the tissues and holding the tissue, and then scar tissue forms around the thread and holds it there. So it's perfect for a patient that wants to have a lift without having surgery.
It's a very, very clever procedure, and basically, is it like a facelift?
It's very similar to a facelift, but I think when I assess a patient and look and see whether they actually require a facelift or threads, I look at how much skin is in excess. If the patient has a lot of excess skin, then they will have a result with a thread lift, but they may need to have something further. So it's a matter of correct assessment of the patient and working out whether that patient needs surgery or whether they are suitable for threads. Now, for those patients that have good quality skin, they haven't got too much in the way of jowling, they haven't had too much of a way of dropping up the mid-face area, then those patients get a fantastic result, and it can be long-lasting as well. So it can last just as long as a facelift in some cases.
So what you're actually saying is that it's not really for everyone, but the best way is to actually come and have a consultation.
Absolutely.
And be assessed, and to see if the threads procedure is suitable for them, because the absorbables are quite a unique procedure with the threads now, and they are the only ones in the world. So you would urge your patient that is interested to come and have a consultation first.
Yeah, I think so. I think it's most important to have that consultation, and also to work out whether the patient is suitable for a surgical, non-surgical procedure, maybe a combination of non-surgical thread lifting and fillers and or Botox and skin treatments. You have to assess the overall patient's quality of skin, etc. Some patients come in thinking that the threads are just for tightening the skin. Well, they're not for tightening the skin, they're for lifting up the tissues underneath the skin. So if the skin quality is poor, then they're not going to get as good a result as, say, someone who has good skin quality. So I think everyone has to be assessed on an individual basis.
Yeah, it's interesting. I sort of look at it like realigning the tissue, and possibly a little bit like Velcro, sort of repositioning the tissue a little bit. Would that be correct?
It is. It's very much like Velcro repositioning. It would be nice to have that Velcro sort of situation in all patients. However, sometimes it's a matter of overlapping the skin, too much excess skin. So yeah, it's very similar to that, and it very much depends on the number of threads that are required per patient as well.
Is there much pain involved in the Promoitalia threads?
Look, the actual procedure is a little bit uncomfortable. It's done under local anaesthetic, sometimes with a bit of sedation. Some patients want it under general anaesthetic, but mostly it can be done under local anaesthetic. So a little bit of a sting of the anaesthetic being inserted. Following that, it's not actually all that uncomfortable. Patients are a little bit swollen in areas, and I always encourage patients to have a few days off work, and even up to a week if possible. However, it's not a particularly painful procedure, and usually Panadol afterwards, and that's all that's required.
That's fantastic. And does it cost? The cost of this procedure, it sounds really amazing. So if you compare it to a facelift, what's the comparison there?
I think you've got to look at the comparative cost. A facelift for treating the face and the neck, for example, is about $12,000 to $15,000 plus hospital fees, plus anaesthetist fees, whereas the threads probably anywhere for a full face and neck, maybe $5,000 to $6,000. So it'd be very lucky to get away with anything less than $3,000. That's really only a small amount of threads, and then increasing the price to around about $5,000 or $6,000. So it's about a third to a half the price of a normal facelift.
Fantastic.
The benefit is, of course, that if you actually have a thread lift, you can have a facelift later without any problems. And there are some patients that I've performed facelifts on that actually require some additional tightening of the tissue, and the threads are perfect for that, so it works in reverse as well.
Fantastic. And with the new absorbables, you would highly recommend that?
Very much so, because the advantage of the absorbables, and I've seen this in facelift patients, that when you actually go in and perform a facelift surgery, you can see the old threads sitting in there, and they become a little bit of a little bit tedious to actually remove those during the surgery. Now with the absorbable threads, they dissolve away completely, so they have no impact on the surgery, or of course you can actually go back and do a few more threads later. So you can always repeat the procedure. It becomes a matter of finance and economics, and whether the patient wants to have a full anaesthesia or under local anaesthesia.
Yeah, sounds terrific. Well, I really thank you for your words and of encouragement, and I'm sure a lot of people will have some more questions for you. Thank you, Dr. Zacharia.